Hey, it's Dr. Ryan here, and I want to talk to you about teething and all of the types of symptoms that go along with teething. A patient had come in earlier with their child, and we were having this discussion about and marveling at all the amazing things that a child's body will do as it prepares for the teething process. Now, unfortunately, sometimes we look at those different changes that it goes through as symptoms that need to be dealt with. And so I just want to clarify. So what are we talking about? When a child's teething, the body knows that the tooth is on its way through. So it's about to erupt, create a break in the skin. That will be an area of vulnerability where your body, like any cut in the body, is vulnerable to infection at an area of opening. And so your body prepares in advance. So how does it prepare in advance? So it will cause a swelling of the tissues, the glands, right? The submandibular, the sublingual, sometimes the glands going down the neck as the body prepares to fight infection. Also, what it'll do is it might start a low-grade fever. What's the fever for? We all know fevers are there to help you fight infection. What else will it do? There'll be a glossing of the eyes. Why the glossing of the eyes? Well, your body innately knows that the most heat-sensitive part of the body, or one of the most heat-sensitive parts of the body, are the cornea of the eyes. And so your body will intelligently create fluids to keep the eyes cool so that they don't get damaged in the middle of a fever. It's amazing to watch and understand this process. What else will they do? They'll start to get a runny nose. Why would they get a runny nose? Because your body wants to carry bacteria out of the body. And so it allows, I mean, it's kind of gross, but that's what it does. The pH of the body will change, and which will affect the digestive tract, which sometimes will result in more loose stools, maybe even to the point of diarrhea. You'll see some redness around the bum, etc. So a typical teething symptoms, if you will, are pain, of course, unfortunately, fever, swollen glands, redness around the bum, runny nose, things like that. Which then begs the question, well then what do we do as parents? Or even as for me as a doctor, what would I do with a patient who's going through that? Any patient who's going through a health event like teething, all I want to do is answer two questions. First question is the body reacting normally? And is there anything I can do to help it do so more efficiently? And the second question is there anything that's interfering with the body's ability to react normally, and can I get rid of that? Right? So as an example, if, I don't know, if somebody eats, if somebody's fighting an infection, right, the fever is there to help fight the infection. So the last thing I want to do is take away the fever, right? I want to keep them comfortable, yes, but I don't want to reduce the fever because I'm taking away their innate attempt to heal. Having said that, on the flip side, so I want to, yes, allow the body to do what it's supposed to, but on the other side, are there any things that would interfere with it? Well, when we're in the middle of a fever, one of the things that would interfere with that process of your ability to fight infection is the presence of sugars. And so I would remove all sugars from the diet as the body's fighting infection so that the body can do so more efficiently. And so when we look at teething as an example, right, so you get the swollen glands, you get the fever, you get the infection, you get the runny nose, right, the body is reacting intelligently to the scenario. So the runny nose, the fever, everything is normal and is in fact a sign that the body's healthy during that process. So the last thing I want to do is take away those symptoms. I want to help them be comfortable, but I don't want to take away the symptoms. So how would I help them be comfortable? Well, I would do things like a nice cold cloth on the forehead, around the back of the neck. I would, massage the neck to allow it to stay as comfortable as possible. And I would remove any foods from the diet that aggravate those types of symptoms. So as an example, the sugars are definitely one of them. Another thing would be dairy. Right? Dairy is a very mucus-producing, or stimulates the production of mucus. So if the body's already very mucousy and the tonsils are swollen, the adenoids are swollen, the mucus production system is in full force and it's coming out the ears or even out the nose, all I want to do is avoid things that do more of that. And so you'd have things like the actual dairy that you'd want to step aside from. So I hope that helps you understand that process. The one thing that I would do to make sure of is once we've assessed whether or not the body's doing what it's supposed to, we also have to make sure that they have a clear nerve system. Your nervous system controls every single function in your body, including the ability to fight infection. And so, i.e. through your immune system. And so I want to make sure that the upper cervical area is clear. Remember, the body needs no help, just no interference. I hope you found that helpful, and pass it on to any parents you know that have kids that are going through that teething process. Take care.